what's up with your pet's pancreas? I'm not sure if everyone knows exactly what the pancreas is or where it lives. So I'll just briefly say it's located in the upper abdomen. In dogs and cats, it's really close to the stomach and the liver and the small bowel. In cats, there's even a more close relationship there, but there are two lobes of the pancreas in pets. The right lobe's along the descending in small intestine, and the left lobe lies right next to the stomach. And they have two functions, the pancreas, primary functions. There's an exocrine function and an endocrine function. And you probably read a little bit about both of those in Dr. Jeff's email, but to go over that quickly, the exocrine function is where this gland actually has ducts that secrete enzymes to help the pet digest their food. They secrete enzymes like trypsin and chymotrypsin that digest proteins, amylase to help digest carbohydrates, and lipase to break down fats. So that's the exocrine function. The endocrine function is where islet cells, beta cells in the pancreas secrete hormones directly into the bloodstream. So that's endocrine, so that's inside the bloodstream. Two of the main pancreatic hormones are insulin, which acts to lower blood sugar, and glucagon, that acts to raise blood sugar, okay? In Chinese medicine, we would include the pancreas as part of the earth element where digestion lives. So that's what we're looking at when we're looking at your pet's pancreas. But there's all these interactions between the pancreas and other organs, of course. It doesn't live on its own. It's part of the digestive system. And it also is, because of the hormonal aspect of it, it kind of plays around with all sorts of other organs, like the adrenal glands and some of these other endocrine organs that are important to your pet. So it's kind of a whole body situation, because when your pet's not feeling good and the pancreas gets upset, you're going to get a bit of inflammation, particularly related to that organ. When we look at inflammation in the pancreas, pancreatitis is what we call it. It's not an infection, okay? It's not a bacterial issue. It's an inflammation issue. It's an exocrine pancreas issue, which means it's that digestive part of the pancreas that's pissed off. Your dog or cat might be vomiting, having diarrhea, not eating, may be really lethargic. Some of these animals are actually having bloody diarrhea. They feel really crappy and can have abdominal pain. That's a real extreme case. Some pets come in with some milder symptoms, right? And you can say a lot of diseases have these symptoms, right? So you just kind of have to evaluate the pet as they come in, and your primary veterinarian, your traditional conventional vet, is going to have some good tools to evaluate the pancreas just by understanding the enzymes that it's secreting. And if it's over secreting or getting upset, they run something called a CPLI to check and see if the pancreas is upset. So that's, on a traditional basis, that's a good thing to have done, have your dog looked at or cat looked at when they're feeling like this. And if the pancreas is tagged as an issue, then we need to understand what might have caused this situation, because pretty much, I think I can say safely that the treatment for pancreatitis as a disease in conventional medicine tends to be pretty much the same for every pet. Would you agree, Dr. Jeff, Dr. Christina, Dr. Sarah? Yeah, you're treating the disease. So the disease always tends to get treated with pain medication, a very limited low-fat diet, and potentially hospitalization fluids, and you just kind of wait and see what happens. I want to express that there are many different causes of pancreatitis. Pancreas can get upset because of many things that include, foremost, chronic inflammation. So when there's been inflammation in the system for a while, it can manifest in the pancreas not being happy and doing its job properly. If you've got diseases like Cushing's disease or other disease processes that are going on, that can also upset the pancreas. Medications can upset the pancreas, so we have to be aware of that. Pets that take steroids or drugs on a regular basis, that can be an issue. The body doesn't necessarily tolerate all those drugs very well, and the pancreas can have a hard time digesting, sending out enzymes to digest some of those medications. You can have environmental and emotional stress. Environment, we're talking about pesticides in the environment, chemicals. There are something called PBDEs, polybrominated diethyl ethers. These are found in flame retardants that get sprayed onto the furniture. Cats especially can be have that as an issue because they will groom, and some of those chemicals will get onto their fur. Did you know that they actually put those type of chemicals in sports drinks like Gatorade, like orange Gatorade? And I can say that my daughter had pancreatitis when she was a youngster, and she didn't have it for any of the typical reasons that people get pancreatitis, which would be drinking too much. She was a young girl. And she didn't have any other issues, but she had been drinking a lot of Gatorade because she was training for a triathlon. So interesting. That could have been a stressor for her. Emotional stress is another thing. I mean, we've got animals that are in the hospital for a while, for example. They can develop pancreatitis just from being out of their home environment. If there's stress in the home, they can get inflammation that will affect the pancreas. So environment and emotions can be a problem. There are breed dispositions, right? Schnauzers, Cocker Spaniels, Yorkies, they tend to be the dogs that are predisposed more towards pancreatitis than others. And then we get to diets. And this is where the conventional veterinarians will really kind of make a point to say that it's probably because they've been eating too high of a fat diet. Well, that's not necessarily true. It's a misleading statement. I read on the internet recently that they're also blaming high protein diets, diets that are sort of biologically appropriate for animals as problems with the pancreas. Well, really what's causing the problem, if you're talking about fats, is if they're rancid, meaning that they've been over-processed and they're not natural fresh fats. So that can be a problem if they're eating processed food. Excess carbohydrates can also do it because they can create inflammation whole body-wise. We'll talk about that a little later. And then, animals that actually eat low-fat diets can have a problem where that contributes to pancreatic and even kidney stress. So we'll see later that fats are really kind of important to the system. When your dog's in the middle of this crisis, it's not that you want to give him a lot of fat. You just want to be aware that in his life, he'll be able to probably digest fats better after he recovers. And that's in my experience, that's what happens. Which brings us to food therapy, because that's what we're really here to talk about tonight, are foods that can help your pets in these situations, and also kind of to prevent some of the inflammation that might happen in the pancreas. Fresh food, I'll say it again, fresh food is the best thing you can feed your pet. You want to avoid high heat, ultra processed food. And I know most of you on this forum have heard this a million times, but it's really, really true. When you ultra process something, you're going to get problems with chemicals. You're going to get changes in the way the food behaves and how it's digested. It loses all of its enzymes that the body was meant to use to digest the food. So now you're feeding an animal something that it's not able to digest because it doesn't have the inherent digestive enzymes in the food. And then we'll find out that pets also aren't really designed to deal with carbohydrates and to digest those either. So we kind of throw them a double whammy sometimes.